The meeting of the Alexander County Board of Social Services now called to order. At this time, I will ask Phil Ackert if he would do the invocation, please.
Our Heavenly Father, we come this time of day, thanking you for watching over us this day, dear God. We thank you for your blessings. Dear God, we thank you for this dedicated staff and their talents as they help meet the needs of our county. Be with us in this meeting that we do the things that glorify you. This we ask in thy name. Amen.
Amen. And on behalf of the board, Phil, we want you to know that we are concerned
Well,
about
thank you. I appreciate it. We're going to be fine.
And we are, praying for you and your staff that, everything work out, okay, and that this not happen again for you.
Thank you.
You're
Thank you very much.
Everyone has a copy of the agenda. Do I hear a motion to approve today's agenda as written?
Make a motion.
Second.
It's been moved in second to accept the agenda as written. Everyone has a copy of the minutes from January the 15th meeting. Do I hear a motion to approve this minute?
I make a motion to approve.
It's been moved in second that we accept the minutes from January the 15th. At this time, we will have introduction of our new staff members.
Hey there. I'd like to ask Dorothy Miller to come up here and Christy Deal. Dorothy's actually been with us since October, but somehow she kind of slid under the radar and did not get introduced to the board. This is Dorothy Miller. Dorothy comes to us with lots of clerical experience. I think she worked at Hickory Springs for probably 25 years, and so we're really glad to have her. And this is Christy Deal. Christy just started with us. She's been there several weeks. Christy comes to us from Iredell Memorial Hospital, and she's got about 10 years in there. So she does a great job, and we're glad to have both these ladies.
Okay, welcome to both of you.
Would you like to keep the joke going as I talked to Christy and I've been working?
Okay. That's on everybody's resumes, huh? I know, okay.
Thank you. At this time, Cindy Holman will now present the January financial report.
And I'm going to come down here where I can see you. We'll be missing Sherry today. Don't ask any hard questions. If you'll look at your monthly financial statement, you will see at the top, the way I always like to look at this thing is, if you look at the top, it says we are 58.33% of our way through the year. So that is where we should, if we were right on track, and there's no budget that's exactly dollar for dollar on track, but if we were right on track, that's where we would be. If you look down under the expenditures at the bottom there at the total, you'll see that we have spent 53.51%. So we have not spent as much as we had budgeted for the year. If you look on down under the revenues, you will see that we have pulled in 52.41% of our revenues, and that, of course, is that's okay because we should, well, it's not okay because we wish we were at 58.33%. But there is a reason for there are some reasons for this. We are running tight, of course. We've only pulled down about 3%, and if you look under our revenues at our child support incentives, you'll see that we've pulled down 2.68% of our child support incentives for this year. And there is a reason for that. And in your packet, you have a letter that I just received today that talks about child support incentives. We have not begun pulling those monies down until this month, or the month of January. We got our first little bit. That was because there was an audit, a federal audit pending over the child support program. We needed to pass that audit in order for the state of North Carolina to receive those incentives. We budgeted child support according to our budget projections that were received from the state last year. So we didn't purposely over budget. what we would receive. However, if you look at that, if you look at on here under revenues, you'll see that child support incentives, we budgeted $46,365. If you look at the letter in front of you, I think it says 19,000 something is what we're now projected to get. We did pass the federal audit. North Carolina did pass the audit. However, the amount of incentives the state is going to receive is not what we thought it would be and what they had told us it would be. So we will not pull down 100% of the child support incentives line. And what does that mean for us? I subtracted it out, and I think it was $26,600 that we projected that we would receive through incentives that we will not get this year. So should we run into a super tight budget problem at the end of the year, that will be one thing that we would be saying to our commissioners. We are going to see how the year comes out, though. Our state aid was not quite as much as we had budgeted thus far. We have not received quite as much as we had budgeted. We are running a little above the budgeted expense in the in-home line. So if you look under expenditures up here under in-home services, you'll see that we're at 67.29%. But this is primarily due to one major expense under that line item, and we had to build a ramp for, or repair a wheelchair ramp for a van. That was a very costly expense. And so that all came under 1 month, and according to Sherry, she feels like we'll fall back into line in that line item. The revenues will jump up. Our revenues will jump up a little bit next month because we received 2 months reimbursements. I know the term 1571 doesn't mean anything to you, but that is the form that we fill out at every month where we pull down all of our revenues. And so 2 1571s ended up coming in 1 month. So in the month of February, we received reimbursements for December and January. That's not reflected on here. So for February, you'll see our revenues move up a little bit. Another issue with revenues is that we are running 2 months behind for reimbursements from the Council on Governments. So this will be rectified by the end of the fiscal year. We will catch up, and we will receive everything we're supposed to. So it's a tight budget year. If you look at this, we're still in the ink. We're okay, but we are running tight. Could get tighter before the end of the year, but that's pretty much our report for this month. And if you have questions, I'll be glad to try to answer them, or we'll get you some information if you have anything in specific about the budget that you'd like to hear about.
I don't have any questions.
Okay. All right.
We will now hear highlights of the statistical report from DSS supervisors.
Okay, on page 1, I just want to point out that the persons logged in at the front desk, we jumped about 400 people from December. So we looked at all the different programs, and there wasn't one single thing that caused the increase. We just had an increase in lots of the programs. We had like 100 more SIP applications, I think 40-some new adult Medicaid applications, so we just had a large influx of people. So that was the reason for the big jump there.
Good afternoon.
Good afternoon.
My name's Matt Reese. I'm one of the Economic Services Supervisors. If you would, I'd like to draw your attention to page 1 of the statistical report. Just wanted to continue to reiterate that in the food and nutrition section, we have continued to not reflect any data at this time due to our implementation of the NC FAST program. The next section that I would like to draw your attention to is in the Medicaid section, and it's the line item labeled number of adult applications. If you will see there, in December, we took 50 applications. In January, it increased to 118. This was in part due to the first part of January, the agency, we received 26 low-income subsidy applications. We refer to it as an acronym of LIS applications. These are generated through the Social Security Administration. When we get those applications, for an individual, it creates 2 applications. It creates one to help the individual pay for their Part B premiums and to get extra help that comes out of their Medicare check. The other application that's created is either an application for the aged or the application for the disabled, depend upon their age. So if it's a couple, it creates 4 applications. And so when we got 26 of those, that then at least creates a doubled amount of applications. So that's why the numbers are increased there. The next item that I wanted to draw your attention to is in the Carolina Access line item. As you can see, each month, beginning from the time that this fiscal year started in July, there's been a gradual increase in the number enrolled in the percentage. This is in part due to the state pursuing and encouraging individuals to get connected with a medical care home, a family care doctor. And so we're trying to get individuals that may have been exempt and may not have been attached to a primary medical home attached to one. We've been sending out letters encouraging them the positives of getting connected with a family doctor. The next item that I want to draw your attention to is the Crisis Intervention Program. As you can see there, in December we had a total number of applications of 18, and in January we had 110. This was primarily due in part to, in January, the temperatures started, getting colder, individuals trying to seek assistance, with their power bills. The next thing that is not on your report that I would like to bring to your attention is the Low Income Energy Assistance Program. If you remember, just a brief recap with that, it opened up December the 1st for households that had specified individuals in the home. Come February 1st, it opened up to all other households that was outside of that criteria. Just some interesting figures for you. Our county was given $91,186 total for that program. At this time, we have totally exhausted those funds. There had been discussions at the state level of reallocating some money from other counties that have not exhausted that. However, they sent out an email just earlier, or the latter part of last week, that they, at this time, were not going to be able to reallocate, that at the expenditure rate that they anticipated in about 3 weeks that counties would would have exhausted those fundings. Our agency opened up February the 1st to take applications. We took 192 applications, with 31 being denied. This was from a time period of February the 1st to February the 4th. By the mid-morning of February the 5th, we had totally exhausted our funding. We went into this on February 1 with approximately $45,000. So in just a matter of Friday, Monday, and in the early part of Tuesday, we went through $45,000 worth of funding. So we was able to help quite a few families. The number that's being denied, those was predominantly where the system may have had like a minor hiccup whenever we was trying to key it in, and it keyed 2 applications and we had to deny one because we already had one in there. I pulled the report. I think we maybe had 5 or 6 that was denied due to excess income. So, I wanted to bring you guys up to speed on that to let you know of that. And I think at this time, that is all that I have. Is there any questions about anything that I've shared? All right.
Do you want to do your NC Fast update now, Matthew?
I was
Well,
going to
since
ask
you're
you
already up
if
here.
you want me to. While I'm up here, we'll go ahead and bring you up to speed on NC Fast. At this point, our agency has went live with the second phase of NC Fast, doing recertifications. Just like I said, continuing to mention about the reports, the state, they are aware of the issues with the reports and the data. It is my anticipation to get the board information come March when I report out for February, because that will be a first full month that all of our data has went from the old system into the new system. Right now at this point, I'm going to be honest, we're barely treading water, trying to get everything processed and done. Staff have been very diligent. Morale, it's been up as about as good as what it can be. Try to keep them encouraged. I do see the positives of this computer system. I want to keep reiterating that because it is going to be a good system, but it's just with anything new, it takes time. It takes a learning curve. Last week, we experienced some slowness in the system, maneuvering around. That impeded our work, but the state, once again, have been very well aware of it. So far, knock on wood, this week, and dear Lord, I hope we don't see smoke billowing from the agency off afar, but right now it has been working, and staff have been able to, get things processed. I am constantly sending communication to the state. Any type of issue that we have, I'm sending a computer snapshot of the screen of what we've been having issues, with, letting them know so that they know about the situation. We had over-the-shoulder support staff with us for approximately 3 weeks. That was a gentleman with the program that came down and basically was a floater amongst all of my staff. He reported out to Cindy and myself that he believes that our county is in one of the better shapes of any of the counties that he's been in, as far as backlog, as far as cases goes, and as far as receptiveness of the staff. He said he has been in other counties where the workers they'll slide back from it. But he said here, he has seen everybody grasp it and trying to learn and trying to acquire the knowledge in it. So I do want to really applaud my staff with how well they have done given this new big change. Comp time numbers, the amount of comp time that we're having to work over, that's continuing to grow. We're going to look at ways to try to figure out how to combat that. One thing that we have done is we have hired 2 part-time staff from Catawba County. And Catawba County was a pilot county for this program. So they've been in it longer than any of the other surrounding counties around us. So we've hired of what I would feel would be 2 of their expert staff. And as a matter of fact, one is back at the agency now. Today was her first day on, and she was very excited and eager to get here to help us get to a better place, to try to assist the staff in any way possible. As a matter of fact, the one that's there now, before the system even went live, she went to the state and learned the program for 2 weeks before they even pushed the program out into the county, into the pilot counties. So she's been familiar, behind the scenes, so she's going to help us troubleshoot / get reviews done, to get clients their benefits in a timely manner as we possibly can. We did suffer 1 resignation. That sort of kind of set us back, but that was by no means of anything from the computer system. We regret that loss, but at the same time, we wish that individual the best in their endeavors. That's pretty much sort of kind of an NC Fast update. I do want to say this, in the upcoming months between Trena and myself, we will be sure to share with you all new information. Exciting things will be coming, and we will bring that to you and keep you all informed. Cindy, is there anything
I just want
that I
to
left out?
brag on Matt and his staff. I think the staff, a couple of weeks ago on a Friday evening when I started to leave, it was about 6:45, and almost everybody was still there. And they were bound and determined. They were not going home for the weekend until they got, because there are cycle dates or issuance dates that by which if they don't get it keyed, the benefits don't go on the next day. Well, they were bound and determined that they were not going to go home until they got all those benefits on the card. So, you know, they've worked evenings, Saturdays. Really appreciate the effort that that staff has made to try to make sure the people in the county are taken care of. And then Matt has, I think we really have to applaud Matt. It's been a challenge at every turn, and he has backed, when we opened up for low-income energy assistance applications, instead of pulling one of those staff, I mean, he has a group of staff, and he only has one person to do that program, and instead of using his staff for that program, Matt himself. So in 4 days, they took, what'd you say, 190 applications? So Matt and one other staff person took 190 applications in 4.5 days. And then even this week, he had his one staff person that does emergency services out. And Matt himself took like 35 applications yesterday. He took 35 applications yesterday himself. That's not always what you want a supervisor doing, but at this juncture, it's absolutely what a supervisor has to do to keep the boat afloat. So
I told the
thanks.
one clerical staff at the front desk, whenever I would come back yesterday morning, I'd say, is there another one? And I'd look, and there'd be multiples. And I told the clerical staff, I said, if you're out there at the end of the road, you know, like the Alltel sign, you know, twirling around trying to stop. Stop.
We did tell him, welcome to the world of his staff.
Yeah.
But he's done a good job.
All right, thank you.
Could I make a comment before Matt leaves?
Yes.
Because he and I have a side bet on this software deal anyway, but I do want to say I'm proud of you. I'm proud of your staff. You mentioned in your comments that when there was a problem, you were making snapshots and sending. Is there any comparison? Do you get any feedback from the division on whether problems you see in Alexander County are unique for Alexander County, or whether it's system problems that are occurring across the state? And I'm just curious.
There's one that we've identified that has just been specific to Alexander County, and we're trying to get to the bottom of that.
But that's not the software.
But
That's
not the
our,
software.
that's
It's-
pop-ups.
Yes,
and
it's
we're
a
trying to
pop-up
do 'em.
box. What happens is the staff can be in there maneuvering in the system, and a little mini version of what the big screen is will pop up. And when they close that out, there may be 6 or 7 more. But we've been sending screen snapshots of that to the state to let them know. We've also been working in conjunction with our local IT department to determine what that is. The slowness of the system, that's been statewide. The rest of the issues have been commonly known.
Have you had a lot of issues? I mean,
It's
They're daily.
it's about every day.
well, and I'm not picking on you, but that's kind of where I thought it would be, just from other stuff that I've seen the division put together and send out in the real world. And I hope it does get better.
Yeah, and the state continually tells us that they do. And Cindy's been in conjunction with other fellow directors, you know, and sending information up and making sure that our voices do get heard. And I do want to commend Cindy, you know, and I try to have bi-weekly staff meetings with my staff. And Cindy is in there in every single one of them, you know, making sure of what we hear and expressing what she hears as well, so that all parties involved, you know the information, and we can get it, you know, shared with the appropriate ones that needs to be.
What we've heard over and over across the state is that the most important thing to the staff is that they feel like somebody's listening when they, I mean, because it's frustrating. And we're getting emails. We are in constant communication with the NC Fast folks. They email us at least once a day to say, some days they'll say, we know the system's slow, please don't send us 100 help desk requests. We're working on it with, here's what we're trying to do. They will say those kinds of things, but they are in good communication with us. It's just a lot to fix. There were a lot of, I believe, unanticipated problems. I know you're surprised by that, Darrell.
I'm terribly shocked because they should have taken care of that before they put it out in the world. I don't have a lot of sympathy for the division, but I do care about our people here and what they're going through with it.
We appreciate that. Thank you.
And I'm glad to see you, Matt, because at the last meeting, I thought you were gonna run for the door, but I'm glad to see you stuck in there and your staff too.
Thank you.
Good afternoon.
Good afternoon.
I want you to turn to page 2. And the first thing I want you to look at is the work first employment participation rate. I don't know if you've noticed, but each month, we're a month behind. And it's because our state program is a month behind. We have to key hours on our employment people. And so right now, we're keying hours for January, but we have until the 20th to key those, and then the participation rate comes out the 21st or 22nd. So I wanted to let you know that's why it's always blank when you see it, but then I always have it on there the next month. We were down in December, and we had some clients with some transportation issues, and so we can't penalize the client and not give them their check when they, didn't have a way there, or they had sick children. So we were down some in December, but the state requires that we do have 50%, and as you can see, we're always well above 50%. Also, if you will look under child care services, at our waiting list, we have 123 children currently on the waiting list. We started this waiting list in August, and we have not served anyone that's on this list as of today. We have been adding on the mandatory program people, such as Work First children, foster care children, and Child Protective Service children. We're also currently spending at 108%, and we're going to have to implement a reduction in services effective March the 1st. We're going to cut out our before and after school care for 10 and 12-year-olds beginning March 1st. We've already sent all those letters out to give them plenty of notice so that they're aware. We have requested some reversion money from the state. We requested between $35,000 and $40,000. That wouldn't help anybody on the waiting list, but that would help us not have to cut any more services. Because if we don't get below our spending with the 10 and 12-year-olds, we're going to have to cut 7 and 9-year-olds also. So we're really hoping we hear from the state hopefully this week or next about the reversion money, because we don't want to have to cut any more services. But I wanted to let you know what was going on, and that we do still, and if you hear anything out in the community about us having to cut services, you know why that we've had to take this measure. Like I said, we're hoping that just cutting the 10 and 12-year-olds will get us back into our spending within 100%. But if not, we'll have to cut the 7 to 9-year-olds. Do you have any questions?
No, thank you.
I'm Julie Sebastian. I'm the Adult Services Supervisor, and if you'll look at page 3 on your statistical report, our SAN home program, we have increased to 7, and we have 10 slots there. And also the enhanced care, as you'll see, 0. That program ended December 31st, 2012, and DMA is now conducting those assessments. And what they're looking at is one payment, one criteria for the home and facilities. Just one thing I wanted to mention, too, about the enhanced care. They did do 21,000 applications in December, and out of that 21,000, 10,000 did receive denial letters, and they are able to appeal that process. And then guardianship, we are down to 5. We lost one last month due to she passed away. And our home-delivered meals, our volunteers, we're dwindling down to 99. Some of those folks are in their 60s and 70s and even 80s and are not able to volunteer anymore. So if you do know of anybody that can volunteer, it's an hour of your lunch time. We have 5 routes, 1 in Stony Point, 1 in the Friendship area, 1 in Bethlehem, and 2 in Taylorsville. And our waiting list, numbers have jumped there. We've got several that are needing the home-delivered meals. Currently, we have I know the report says 24, but currently we have 16. We've looked at that, assessed several folks, and we have an assessment tomorrow. We've taken some off of our waiting list due to going to CAP services, no longer needing it, deceased. So, does anybody have any questions? Okay, thanks.
Well, good afternoon. I'm Holly Yongue. You can draw your attention to page 5. Because page 4 was a short little page, and so all the Child Protective Services information is on page 5 and 6. You can see that we accepted or took 74 reports in the month of January and screened in 60. That, excuse me, we had 58 cases or 58 investigations open on the last day of the month in January, and we had 34 in-home family services cases open on the last day of the month in January. And we served 116 children through the investigative or assessment process. I really want to draw your attention to the second block of information that we capture on that page, and that's the number of children in foster care. So you can see that in 2 months' time, we've gained 7 children in our custody, and we have continued that trend, unfortunately, into the month of February. Of those 7 children, at least half of them, so at least 4, are in mental health, either a therapeutic level 2 or level 3 placement. One child is currently in an emergency bed, awaiting an appropriate placement. We are facing some very difficult challenges with our children that have some pretty chronic and severe mental health needs. They are being recommended for higher levels of placement, psychiatric residential treatment facilities or level 5. That's the highest level of care in the mental health system our children can receive. And then there's level 3, which is a step down from that, then level 2 or therapeutic foster care, and then traditional foster care. Many of our children are coming to us with very, very high mental health needs, needing a higher level of care that can't be met in a traditional foster home. We are seeing recommendations once those children have what's called a comprehensive clinical assessment for placement in level 3s or in PRTFs, the psychiatric residential treatment facility. And our children are being denied from the local managing entity level. Their utilization management group reviews those children once those requests are submitted, and they make a decision based on what is submitted, whether that child meets the criteria for that level of care or not. Yesterday, we identified 7 children that are waiting or are in a placement that has currently been deemed. They're either waiting to go into placement somewhere, or they've been denied what has been deemed by another professional to be the appropriate level of care. And so we have notified the LME of our concerns with this area. We've discussed it with our attorney. We have learned that our agency was not appropriately being notified of denials. Those letters were actually going to foster homes or placement providers. So we've corrected that. It is our intention to appeal those decisions. Our attorney will prepare those appeals for us and submit them back to Smoky Mountain Center for review, hoping that those children will indeed be placed in the appropriate placement. Because what happens is that we really, when we get a child into foster care, we have every intention of that child being placed in the appropriate placement from day one. That doesn't always happen, especially with children that have needs that present the longer they're in foster care. But when we are placing these children into recommended leveled facilities with the hopes that their placement there will be approved, and then we're having to move them, those disruptions in a child's life just further that cycle of grief and loss that they're going through, so just adding to those issues that are already there. And so more treatment is needed. We are really, really struggling with that right now. And some very young children with some really significant issues. And so I just want you to be aware of that. You'll see that one child was cleared or legally freed for adoption in the month of January, and that we were able to complete 2 adoptions. You'll be seeing more of those. We're very excited about that. We're always excited when children, if they're not able to be reunified with their family, which is always our primary goal, but if not, that they have a safe and permanent home. to be in. And on page 6, you will see that we were able to increase our foster home license by 1 in January, and we have already placed a child with that brand-new family. So I will be glad to answer any questions that you may have.
Holly, under foster care, when you were talking about the notification process and so on,
Yes, sir.
do you occasionally have contact from the LME and the service providers? I'm surprised when I wasn't shocked, but a little surprised when you said you weren't getting notification, they were sending it.
We have regular and ongoing contact with service providers and the LME almost daily, to answer your question, depending on the child. But we really have almost daily contact with the LME or the care coordinator who's assigned to our area because of the number of children that we have that need services. And in talking with her, what we discovered is that placement providers' names were being given as addresses for children. Excuse me. And so those letters were going to the placement provider, but I was informed that those come certified mail, and so there's no way we're going to miss them when they come to the agency, so I was glad to hear that. So now it's just making sure that we have those letters, and once we get them, then actually our notification doesn't start until the letter is in our hand because we're the custodian, and then we can start our process of appealing those decisions.
Well, a couple of years ago, we were having problems with the right people talking to people in Alexander County, but that's not the problem. We just need more service.
It doesn't, right now, I wouldn't say we don't have a line of communication because we definitely do. Some of the issues that we are faced with, unfortunately, the way the system is set up now, I call it silos because you have care coordination and care management. You really have that group of people that focus on the services that families and children can get, or that have where they are and what the services are. And then you have utilization management. Well, they're set up in a completely separate building, and they never have contact with the people that are out in the field and working with us or clients. And it's set up that way intentionally, is how it's been explained to us, because they really just want to see on paper, does this person meet the criteria? You know, I could give you my opinion about that, but I won't because it's just my opinion. The care coordinator, no matter what their opinion or recommendation is not allowed to talk to anybody that works in utilization management. The same company, so Smoky Mountain Center, the care coordinator is not allowed to talk to anyone that works for the same company in utilization management.
And there's some reasons for it.
I understand.
I don't agree with all the reasons,
Right.
but I understand. 2 years ago in North Carolina, there was a shortage of service for children that fit in the classifications you're talking about. I understand when you say a level 5, I have no idea
That's
what
like
that
a
is.
hospital. That would be like a hospitalization.
North Carolina is, I'm assuming, still short as far as
Yes, sir. Very.
how, and you may not have the answer to this, but if you have a child, level 5, how long would you anticipate to get that child into the proper situation for treatment and care?
Well, level 5 would actually be a hospitalization, and we have very few children that are actually hospitalized. Put in the hospital. My tongue won't work. Thank goodness, because that is not a good process for anybody that's involved. But a lot of our children will be in emergency shelters or in a therapeutic placement waiting to go into a level 3 or into a psychiatric residential treatment facility, which is typically the highest level of care that we deal with. The wait time can be anywhere from 30 to 90 days. And Cindy and I have had this conversation. When we have a kid in crisis, 90 days is a long time to wait for a child to be getting the help that they need. And the education that they need, because they may be missing some of those components, and so you have to arrange for those things to be done while those children are sitting waiting to go to the appropriate placement.
And for us, one of the most frustrating things is that we have absolutely no control over it. for the last 3 Friday afternoons, we have been at the agency with a child who needed to be placed, didn't know where we were going to put them, and people were going home. Things were closing for the weekend, and we were sitting there with a kid trying to figure out what in the world were we going to do. And so it's really concerning. I don't think the partnership's not there. The communication is there. We just are not able to access services.
And there is a lack of appropriate placements in this, I mean, like psychiatric residential treatment facilities across the state, there are 4 or 5. They're very few and far between. And so you can imagine if we have this need in our little Alexander County, when you stack up with Mecklenburg or Wake or those larger, I mean, we're really in a crisis with lots of kids. It's really a very sad situation. So far, I've only had 1 staff to have to spend the night with a child at the agency in the past month. But I have had a staff with a child at the agency in the past month.
Many nights at the hospital,
Yeah.
but not at the
Yeah.
agency.
Because he wasn't able to be maintained in a regular foster home after he came home from a psychiatric residential treatment facility, was placed in a foster home for 1 night until he could go to his level 3, which is the step-down facility, the next day. Couldn't make it in the foster home, had to pick him up, bring him back to the agency and stay there with him because we had nowhere else for him to go.
And I appreciate that, Holly. I wanted the board to know, and I wanted people who listen to this program know that in North Carolina, we do have severe shortage of some services that are needed for children and adults.
It's
And,
critical. In my opinion, it's a critical need for children and adults. I agree. Any other questions? Thank you.
Thank you.
I did want to mention before we move away from the statistical report, it's not really anything that's on the report, but Carol Church is not here today. She's off. But next month will be her last meeting with us. She's retiring. Effective April the 1st. And she did want me to mention about child support that they are starting to intervene some tax returns. She wanted you to know they're going after it. So.
If that's all the reports from the supervisors, excuse me, our program today will be Medicaid transportation, presented by Trena Riddle and Christy Markhammer.
As we've told you in the past, we had to pull one of my family and children's Medicaid workers to do Medicaid transportation because it was a program that we had to be doing for our Medicaid clients. And so Christy was the lucky winner. That's how we look at it. It was a lucky winner to get to do Medicaid transportation. And Karen Brown is her backup. So when Christy's not there, Karen covers Medicaid transportation. We started last February, and it has grown tremendously. We started out with maybe 100 clients. And I think now we have 450 clients using Medicaid transportation. So it's really grown in the last year. And Christy is going to do a little presentation and tell you about Medicaid transportation.
You have a copy of our transportation policies. And last year, January, the state kind of changed everything with Medicaid transportation. So we had to kind of revamp and change everything of how we handle Medicaid transportation. So as Trena said, when we started doing transportation, we had about 100 active Medicaid clients receiving transportation, and now we have just over 450 clients receiving transportation. And when we first started, we used only Greenway buses, and now we also issue gas vouchers. And last month, we did about 641 trips, and of those 640 trips, 443 were gas vouchers, and that totaled just over $5,000. So it stays in the county. And clients can request transportation assistance in a couple of ways. They can call in and request assistance, or they can request assistance using a form in their review or an application. And when they call in and request assistance, we do a state-mandated assessment over the phone with them, and we ask a couple of questions about how have you been getting to your appointments? You know, has something changed of why you need assistance? Just kind of, you know, figure out what's going on with them, why they need assistance. We also try to determine if they have any special physical medical needs, so that the Greenway buses need to know anything, or if they have any special car needs or anything like that. We also determine which method is best for them, if gas voucher is best or if the Greenway bus is best. We do 29 cents a mile with our gas vouchers, and that a lot of times proves to be the most economical method, because we do have to do the most economical method, and we also have to go to the most closest medical provider that's suitable for the client. So they can't just go to wherever they want, whenever they want. And if a client is disabled and cannot drive, we do use Greenway. A lot of them are disabled elderly clients that can't drive and don't have anybody to take them. So we use a lot of Greenway bus. And each client has to call with every appointment to get each appointment approved. So I get a lot of phone calls every day. And state policies only allow us to go to certain providers, and if they have to go to a provider that's outside of our county or doesn't border our county, we do have to get a referral from their provider. And if they also want to go to a provider that's not local, that, you know, somebody else local can provide that same service, they also have to get a referral for that also. And then and once they receive assistance, we have to get verification that they have gone to their appointment and received a Medicaid covered service. So we make sure that, you know, everything is legitimate. And if they do get a gas voucher, or they, you know, don't call and cancel their appointment with Greenway, they get a no-show. And after 3 no-shows, they are suspended for 30 days. And then clients receive notices of their no-shows, and they receive notice that they're suspended. And we maintain a file for each client, so that way, after each quarter, we get audited or monitored. And Trena does my monitoring, so she makes sure that I've kept all my records straight and everything, and have all my verifications for each client. And do you have any questions or anything?
You had two numbers, 641 and 443. What period of time?
January.
That was January, okay.
And we're pretty close to 500 just for February. So I've been pretty busy.
I just want to say Christy's done an awesome job. We actually got this program we use for transportation from Caldwell County. They gave us a copy of their program, and Christy's had to tweak it, and she has done an awesome job. She has got in there and learned how to use the program and got our program up and running, and Karen also, I mean, it was a big change for us, so I think they've done an awesome job. Thank you.
Thank you.
Thank you. We will now hear items from our DSS Director, Cindy Holman.
And I'll be brief. Matt did your NC fast update, so I won't have to talk about that today. We do have 3 vacancies. We have 1 vacancy in the Family and Children's Medicaid unit. We just recently had a resignation in our FNS unit, and then we actually transferred someone from our Family and Children's Medicaid over into Food and Nutrition Services. We have a vacancy in our child welfare area, a community social services tech, and I had our CPS social worker 3 position on
Just filled it.
here, but we have filled it today. So we have 2 vacancies then instead of 3. Yay! I did want to say that we do have our vacant board member seat, and we have approached someone who is strongly considering that position, and we've given him some paperwork, and we're hoping that we'll have a new board member next month. We'll have to send that in to the Social Services Commission, and do you know when they meet again, Shelley?
They should meet once a month.
Okay.
That-
So we hope we'll be able to get that taken care of fairly quickly. The only other thing I had, there are a couple of extra handouts in your packet. One was this report coming out of the child fatality, North Carolina Child Fatality Prevention Team about all-terrain vehicles. And I thought just for Alexander County, because we do have a lot of four-wheeler riders, that it was real interesting. If you look just on page 2 of this report, during the 12-year period between January the 1st of 2000 and December the 31st of 2011, there were 78 deaths for children in accidents while riding ATVs. Senate Bill 189 was passed. It outlined restrictions, helmets, and those kinds of things. Children under 12 not being able to ride, I think, without some supervision or something, and went into effect December the 1st of 2005. In the 6 years prior to the bill, there were 49 deaths in North Carolina, an average of 8 deaths per year. In the 6 years following the bill, there have been 29 deaths, an average of 5 per year, a decrease of 59%. I just thought that that was every opportunity we have to say, wow, good legislation makes a difference, and this was an opportunity to say that has, not everybody agrees with the new rules under that Senate Bill 189, but it has made a difference, and if we've saved one child's life, then that's certainly, and that is coming out of the State Child Fatality Review Team, which, if you've ever been to the collaborative, we'd invite you. Sometimes we have a protection team, and then we have a fatality team that reviews all child deaths, not just abuse, neglect, but it reviews any death in the community each month. So I just wanted to bring that to your attention. I thought that was great news. You do have a monitoring report. You see this letter from the Division of Medical Assistance dated February the 15th. They don't have that? Do you have
I
it?
didn't have it, no.
I gave it to you and said make them a copy, and then you gave it back to me. Do you have this,
I don't think so.
this letter? Okay, well, maybe you don't. I will pass it down the road. It just says that we had a monitoring by the Division of Medical Assistance and that we did a great job. We had just a couple of little things you'll see at the end of the report, but we passed this review, and as you know, they're really looking at Medicaid right now and how we might save money. So I would say that they're probably a little tougher than they've ever been before in monitoring us. So I'm going to pass that down the road and let you see that in all categories we met the required standards, and we're really proud of that. Our staff, even in a time when you see applications jumping up, when you see us having to pull people off of one job and have them do something else that's required, when we're trying to negotiate this new NCFAS system, they're still meeting standards, and that's just a kudos to our staff. And I did want to just mention to you that we have put in an application. I don't know whether we'll be approved or not, but I know you've seen in the papers that Alexander County has some Golden Leaf funding available, and there's an application process for that. And we, as an agency, have put in an application. We talked with the school system. We felt like some of the goals that were the committee, the Golden Leaf Committee, some of the goals identified for Alexander County were to reduce or to increase the graduation rate for the county, to have more folks go into post-secondary education, and also for people to remain in our county and live and work here if they do get an education and not leave Alexander County. And some of those goals we felt could be accomplished through us having social workers at the schools in these upper grades. So we proposed 3 social workers, one for each of the middle schools and one for the high school, that would work under the auspices and the rule, law, and policy of DSS, but would be located at the schools. So, and they would have a multidisciplinary caseload that would address whatever issues. If that child's in foster care, if that child has a CPS report on them, but they're at that school, someone that worked there at the school every day that could be available to them and working with them and really involved real heavily in education as well as social work. We might even be able to do a little preventative work. We have a hard time keeping our head afloat, just doing the services that we're mandated to do right now. But if we had these 3 additional workers and they were at the schools, we could possibly work with the schools to identify these high-risk students that maybe they don't meet the definition of abuse, neglect, or dependency, but we can all look at that situation and know that that child's highly at risk. So we have done a proposal and submitted it, and we'll keep you abreast of that, let you know if we get good news or the other. And that's all I have.
Well, that's certainly encouraging for our county and for our school system. Are there any items from the board at this time?
I would like to get, if you don't mind, a copy of this letter sent to the commissioners and the county manager, because our county health department had an audit not too long ago, and they had an outstanding report, and I'm proud of DSS for having an outstanding report also, and we need to pass the good news along with the other. If you would, I'd appreciate it.
Take care of it.
If there's no other items from the board, do I have a motion to adjourn at this time?
Motion to adjourn?
Did I get a second?
Second.
I do have a motion to adjourn and second, and our next meeting will be March the 19th, 2013, at 4:00 p.m. Meeting adjourned.